So good afternoon. Welcome to the webinar with USDA Rural Development Senior Leadership regarding Health IT and Telehealth Program funding for rural America. In today's webinar, we're going to be receiving information from the following senior officials from USDA Rural Development in a number of states. I am speaking right now, Jessica Zufolo. I'm the Deputy Administrator for the USDA's Rural Utility Service. Next, we will hear from Patty Clark, who is the State Director for USDA Rural Development for Kansas. Patty will talk about the Community Facilities Program. Next, we'll hear from Bill Menner, the State Director for USDA Rural Development in Iowa. And Bill will talk about the Rural Economic Development Loan and Grant Program. Then I will be speaking about the RUS Distance Learning Telemedicine Grant Program, and then we will hear from Billy Kerb, who is the Business and Cooperative Energy Specialist at USDA Rural Development in Texas. And Billy will talk about the Rural Business Loan Programs. And we're very excited to have an opportunity to discuss all of our terrific funding vehicles to support telehealth and health IT in rural America. USDA provides a series of loan and grant programs that support health IT functionality as well as telehealth and other allowable costs to facilitate the deployment and the use of high-quality, affordable health care in rural communities. In today's discussion, we're going to be talking about the Community Facilities Loan and Grant Program, otherwise known as the quote-unquote CF program. Next, we will talk about the Rural Economic Development Loan and Grant Program, which is another terrific program that provides funding for a variety of economic development needs of community-based institutions in rural communities. Then we'll talk about the Distance Learning Telemedicine Grant Program, which is a grant program that the Rural Utility Service administers to provide funding for electronic medical equipment and other types of equipment needed to facilitate high-quality health care in the most rural and remote areas in the United States. And then finally, we will be discussing and be provided an overview of the business and industry loan guarantee programs that are also terrific vehicles for health and health IT needs of rural hospitals and clinics. The Rural Development website to receive additional information on all of these programs is on this slide, which is www.rurdev.usda.gov. USDA Rural Development has a long-standing historic commitment to economic development and financing opportunities to meet the infrastructure and quality of life challenges of the country's most rural and remote communities. We are deeply committed to helping improve the economy, the quality of life, and the vitality of rural America for years and years. We have had a long-standing commitment to provide financial opportunities and solutions to support the needs of rural communities, essentially receive the same, if not better, service as those services that are provided in urbanized areas. So we not only provide rural electric and telecommunication services and facilitate the deployment of broadband and renewable projects in rural communities, but we also provide funding for community facilities such as water and sewer systems, housing and health clinics, hospitals and schools, emergency service facilities to help our first responders in rural communities get access to advanced technology and all areas of facilities needed to meet the emergency needs of our communities. We promote economic development by supporting loans and businesses as well as nonprofits. The total amount of funds that we have provided to date is about $20 billion, and in sum, in loans, loan guarantees, and grants through our programs just in the last fiscal year alone. So the extensive nature of the work we do really can I think, revolutionize and support the needs of our rural health institutions in getting the types of services and facilities and infrastructure that they need to be self-sustaining and ensure that the residential consumers in their area and patients get high-quality care. So there's a number of cost barriers for anyone seeking to provide health IT solutions to rural areas. And in particular, critical access hospitals and rural hospitals have a number of barriers to meet their meaningful use requirements and get the type of technologies and solutions that they need to really provide the services that is so highly needed for the patients and the community at large. Some of the barriers include acquisition and installation costs of certified electronic health records, hardware and software, training costs for installation and integration of certified electronic health records technology, and of course broadband infrastructure. These are extremely costly areas for critical access hospitals to overcome, and these are some of the barriers that we all see and are familiar with when rural hospitals and rural hospital administrators come to rural development to figure out how to manage these cost challenges. So some of the examples of things that rural development can cover in terms of the costs that our loan and grant programs may be able to cover include the cost of acquisition of certified electronic health records, software, and hardware, as I said. These include costs for transition from an initial certified electronic health records to an upgraded or a distinctive second certified electronic health records database. Other costs include hardware and software other than those that are certified electronic health records databases are necessary for the administration of certified electronic health records or necessary for the integration of these databases and of this functionality with patient care. These are some of the costs that are allowable under our programs that we will be talking about in a bit. Other examples include the end-user applications and devices. So such devices include health IT applications that help health professionals in a critical clinical setting to interact with the electronic health records for integration of certified electronic health records into patient care. These are some of the applications that we can provide financing for. Other examples include all areas of broadband infrastructure. At the USDA's Rural Utility Service, we provide loan and grant financing to cover the network construction costs of broadband infrastructure needed to deliver telehealth and health IT to rural hospitals and rural residential consumers, including veterans. So we're very proud of the work that we do in meeting these very important yet costly infrastructure costs and hardware and software costs that rural hospitals and clinics incur. Another area that our programs may provide cost coverage are labor and technical assistance costs. Such costs include that we provide coverage for is assistance in implementing software, hardware, and network assets, installation of hardware and non-certified software necessary to integrate certified EHRs into both inpatient and external environments with patient care, which also include allowable costs for digital images to be integrated, medication administration, and dispensing systems that interface with EHR. So these are some of the costs that we want to make sure that everybody on the call is aware of and really can think about strategically as to how these costs can be covered through the programs we'll be talking about. And then training. Training related to configuring networks, including network security, virtualization, and disaster recovery, as well as implementation knowledge for the software program, and also training for staff regarding system maintenance. So think strategically about how all of your training needs can be met through the programs that we offer at USDA Rural Development. At this point, I will be turning the discussion over to my colleague in the state of Kansas, Patty Clark. So thank you very much, Patty, and I will hand it to you.
Thank you, Jessica. We really appreciate this opportunity to share our Rural Development Program information and help provide solutions to financing this critical investment to improve health care through technology and connectivity. Our community facilities programs were established by Congress to provide essential services to our rural communities and rural residents to help them improve their health care and their level of safety. I want to talk briefly about the basics of our community facilities program, starting with the funding that's available for fiscal year 2013. We have $70 million in direct loans available and $10 million in grants. It's important to also understand what our eligibility requirements are in order to tap these financing programs. Rural areas and towns of up to population 20,000, the applicant must be a nonprofit, government, or tribe, and eligible costs include the construction of a hospital or of the nursing home, outpatient facility, physician clinic. It could also be renovation of a facility, and it also could cover equipment purchases. However, training and technical assistance as well as maintenance costs are considered operations and management costs and therefore are not eligible for our community facilities program. Under the CF Direct program, which is a direct loan made to the eligible entity, the maximum repayment term should not exceed 40 years. Currently, our third quarter interest rates are, for those at poverty level, 4.5%, intermediate is 4%, and market rate is 3.5%. Under the CF Guaranteed program, the maximum repayment term, again, is not to exceed 40 years. It is a fixed or variable rate negotiated between the lender and the borrowing institution, and there is an additional one-time guarantee fund applied to the loan. I think it's important to remember that though our grant funds are limited, we do have significant capital investment available for our direct loan program, and obviously, as you can see from this slide, the terms of our lending are very, very favorable right now. Rural health care providers may apply for CF funding support for the purchase of equipment, such as a new CT scanner or for mammography equipment, health information technology hardware, and its related software costs are also eligible. I think it's also important to remember that you're going to have rural development staff working with you side by side to help you complete the application. You don't have to do it alone. You're not doing it in a vacuum. And there's an entire set of people who have tremendous experience in working with hospitals and healthcare institutions on these types of projects to guide you throughout this process. In the past 3 fiscal years, just to give you an idea of the significant investment we have made throughout rural America with our CF program, you can see we've reached almost 8,000 projects for critical community facilities and served over 30 million rural residents throughout America. That includes nearly 950 educational projects in addition to 433 libraries, over 1,000 healthcare facilities, and 3,300 public safety facilities. I think it's also important to note with the picture in the cut line that our community facilities program can be a direct conduit to economic development in our rural communities. In this particular case, a young dentist returned to her hometown to practice out of a building in Minnesota, and that building was financed through our community facilities program, even though it was a new business, adding jobs and adding economic activity to that small community of Elgin. There are many success stories that we can talk about. I'm going to highlight three. The first one is from Breckenridge, Texas, and that particular hospital, Stevens Memorial Hospital, had a mainframe system that was over 15 years old and a server that was over 9 years old. And through our community facilities program, they upgraded their hardware to accommodate the latest in technological services in order to meet the new proposed regulations regarding healthcare organizations and hospitals installation to be ready and fully operational with their electronic medical records. $410,000 loan and a $50,000 grant made that project possible in that community. The next one I want to highlight is a story here from Kansas. The Great Plains Health Alliance in Kansas acted as the borrower, and they purchased health record hardware and software for 22 of our 83 critical access hospitals. Through this purchase, those hospitals are now able to provide telemedicine services, virtual consults, diagnostic exams and imaging, and remote monitoring of patients. That was a $2.2 million loan guarantee, which had we were working with partner banking institutions, and a $3 million community facilities direct loan. The final example I want to cite is a small hospital in a small community in north central Kansas called Onega. They coupled their electronic medical records, hardware and software purchases with some renovations and enhancements to their existing hospital. And they bundled those together to create a nearly $5 million CF Direct loan that included the hardware and the software, not only in the hospital, but in the surrounding health care clinics that are a part of their system. But they also purchased diagnostic equipment and refinanced some existing debt. Those three examples show you the diversity of what our community facilities program can do for healthcare facilities, not only relative to telemedicine, but also other purchases and enhancements as well. And with that, I am going to turn this over to my colleague, Bill Menner from Iowa. So it's over to you, Bill.
Well, thanks, Patty, and hello, everybody. Thinking about the way we have been approaching health IT and working with rural hospitals, community facilities is a great option. It may be the best option for you, whether it's loan or grant, but it's a great fit. The REDLG program, or USDA Rural Economic Development Loan and Grant Program, is an excellent option as well, and for a lot of reasons. REDLG, which is really what everybody calls it, is a pass-through program where USDA is working collaboratively with eligible utilities. Typically, they're rural electric cooperatives, rural telephone cooperatives, and eligible municipal utilities. Like the name indicates, there are both loans and grants available. REDLG Loans provides a loan to that eligible utility, which they in turn pass on through to a local project, and that local project has to in some way create or retain jobs. The REDLG grant program does about the same thing, only it's a grant. That REC or telco or municipal utility gets to revolve those funds out because the grant program is intended to create a revolving loan fund. So again, they're going to revolve those funds over and over and over again. And honestly, REDLG is a great program for economic development in general, because those dollars keep turning over and over, and they really can have a huge impact. And those rural electrics or telcos or munis that use it really are having a huge impact on their community for years and years to come. the REDLG loan program is just what it says. It's a loan from us, and it actually is going to the utility. So the utility shows it on their books. It's intended to promote rural economic development, create or retain jobs, and it can go to a lot of things, including startups or expansions, generic public development projects of one kind or another, including a hospital project, business incubators, project feasibility studies, and advanced telecommunications and computer networks intended specifically for medical and educational services. Again, that's a loan to the eligible entity, and they make that proposal to us with a specific project in mind. So in this instance, you might be working with your rural electric cooperative who's working with their local USDA specialist, and they identify your project as something that they want to pursue. So they actually go through the application process for something that's specifically related to what you want to accomplish in health IT. The REDLG grant program is just that, a grant from us to the utility, which they then turn around and create jobs or retain jobs. But it's a little more specific. We're looking for them to do a project that is community development related, that is involving training or education for rural residents, that's specifically related to medical care for rural residents, including training, or somehow advancing or using advanced telecommunications for medical or educational purposes. Again, they just keep that. They pass the dollars on to the ultimate recipient, but those aren't paid back to USDA. It truly is in the form of a grant. In this current fiscal year, there's plenty of loan money available. You can score a loan for us for a project, and you really will not be competing for the funds. There's quite a bit of REDLG loan money available. That's not the case with the grant dollars, at least now through September 30th. There's $10 million remaining, but there's millions in the pipeline, so we're probably talking in reality $2 to $3 million available right now, and it will be extremely competitive. And I think it's fair to say we will run out of grant dollars before September 30th comes. So at least in FY13, it might be a better fit to look at a loan because at the end of the day, the terms for you, the hospital, or for an applicant is going to be very similar. The eligible entity is, and that's the electric entity, is someone who currently has a loan with the Rural Utility Service for a population of 50,000 or less, or it could be somebody who has borrowed and repaid or has prepaid a previous loan, or a municipal utility that has gone through the process and has been deemed eligible to get assistance through the Rural Utility Service. That's how we fit municipal utilities into the mix. So typically, again, an REC, a telecommunications cooperative, or an eligible municipal utility. Here are the terms, and this is why it's so attractive. For the REDLG loan program, you can borrow up to $1 million, at least $10,000, and the recipient can defer payments for up to 2 years. And there is also a requirement of a 20% match, but the terms are 0% for 10 years. For the REDLG grant, the most you can get is $300,000, again with a 20% match, and the term is 0% again over 10 years. So it's not free money because you do have to pay it back, but because there's no interest, it's the next best thing to free money that you can consider. And for the REDLG loan, when you can get 0% over 10 years for up to $1 million, that's pretty good. And looking and thinking about how a lot of the HIT projects we've seen here in Iowa are coming in as far as their price tags, the $1 million REDLG loan is a great option. We've done a lot of REDLG grants in the past too. Here's an example. In Algona, Iowa, the Kossuth Regional Health Center wanted to install some integrated technology as part of a broader EHR system. which they were also extending into a brand new wing of their hospital. They built new patient rooms, and they wanted to include in those patient rooms access to their electronic health records technology, their network. And this project was going to cost about $360 or $360,000. Working with their local rural electric cooperative, which was Corn Belt Power, they applied for and received a $300,000 REDLG grant. So again, because you have to kick in 20%, Corn Belt did, the total project cost was $360,000. Again, paid out over 10 years at 0% interest. A great example of an excellent project. In Pocahontas, Iowa, their community hospital, working with their municipal utilities, had a $1 million project they were looking at. Again, they wanted to implement full EHR. They needed some hardware. They needed new servers. At the end of the day, they got a $300,000 REDLG grant from USDA. In this case, the municipal utility didn't kick in an extra 20%. They kicked in an extra 120% match and made an additional loan to the hospital. And at the end of the day, the $1 million project was met, and their hospital administrator was pleased. And as he says in this quote, we couldn't have done it without the financial support that was offered by USDA. Again, these are partnerships, and these rural electric cooperatives, the telcos, the municipal utilities want their healthcare systems to be successful, and they also understand that the benefits that they can bring by making these investments through these pass-through dollars really is a great opportunity. So with that said, another great opportunity comes in the form of our distance learning and telemedicine program, and we'll send this back to the Rural Utilities Service and Jessica Zufalo.
Thank you so much, Bill. And again, I wanted to remind the audience of just what a tremendous panoply of opportunities that the USDA Rural Development Mission Area offers to expand telehealth and health IT opportunities. I'm going to talk about another grant program that we have available to rural communities, and in particular, anyone in a rural area that's seeking to utilize technology to receive advanced medical care or any type of advanced training or anything in the field of health delivery. So I'm going to talk about the Distance Learning Telemedicine Grant Program, otherwise known as the DLT program. This is a program that's not just used for medical equipment. It's used for a number of different purposes. The focus is using the unique capabilities of telecommunications technology to connect rural areas and help them overcome barriers of distance and density to receive the highest quality educational services and medical care that's available to urbanized areas. This is a really terrific tool to really connect communities with hospitals and educational facilities in urbanized areas and really help our students, help our nurses, our veterans, and our doctors communicate and be part of the rural economy. So the telehealth, distance learning telemedicine grant program really helps facilitate and expand telehealth opportunities and provide opportunities for health IT solutions to be available in these areas to improve access to advanced medical care, again, regardless of distance and density. And really, we want to help communities figure out ways to cover the extraordinary cost of getting to a hospital that may be hundreds, if not thousands of miles away from their home. We want to make sure that patients and doctors that want to stay in a rural area can continue to provide care and patients receive care. So some of the solutions may include electronic bandwidth-intensive applications that rely on video teleconferencing equipment to improve the quality of care in the most remote rural areas, tribal areas, and ensure that our farming and ranching communities get the best possible care that our urban counterparts receive. So in FY 2013, the amount of money that's available under this program is approximately $15 million. This is a nationwide grant program, and it's extremely popular and very, very competitive. And so this is the amount of money that we have to make available for projects nationwide. It's not a lot, but it really does such a tremendous job and has such remarkable results in providing solutions and opportunities and really help revolutionize the economies in our farming and ranching sectors. So the Distance Learning Telemedicine Grant Program serves those communities that are eligible in communities that are a population density of 20,000 or less. The purposes must meet the grant definition of distance learning telemedicine and really focus on sustainability. We cannot provide grant monies for things like studies, research projects, or short-term demonstration projects. It also is not eligible for an individual to receive a grant, but yet it's solely for the purpose of institutions and entities that are designed to provide a community-based service to the population. So for-profit and non-for-profit entities are eligible. Again, no individuals or sole proprietors are eligible for this program. The terms of the grant and the application design are such that it's typically open for a 60-day application window period. The application window opens at least once a year, and usually the application window would open sometime around the end of May, the beginning of June. We hope to make this application window open around that time. The window will be open for a 60-day period and will be published in the Federal Register so that everybody can access the terms and conditions and the notice of funding availability that determines the specific design and requirements for applicants. We will make sure that all critical access hospitals and all rural health clinics that we work with, all of our partners that we work with at HHS, HRSA, SAMHSA, as well as state and local health organizations are aware of the grant application window opening for the DLT program. Again, it's a very competitive program. It's nationwide, and we have a 15% matching requirement, really to make sure that the entity that receives the grant has real equity into the project so that there's a real commitment there to ensure its success. The minimum grant under the DLT program is around $50,000, and the maximum grant award is $500,000. The project must be focused specifically on a number of very key areas of eligibility and purpose. So specifically, the DLT program covers allowable costs involving computer hardware and software, computer network components, terminal equipment, data terminal equipment, inside wiring, and inside OEM authorized warranties on equipment up to the 3-year life of the grant. So this will give you a sense of the type of specific technology piece parts of internally a health institution or hospital, school, or a clinic, and the kinds of costs that we can cover under this program. Now I will turn the discussion over to a colleague that we are very proud to have on our webinar today, Billy Kerb, who is with us from the USDA Rural Development Office in Texas. He's the Business and Cooperative Energy Specialist, and Billy will discuss the Business and Industry Loan Guarantee Program, otherwise known as BNI, and this is a program that's administered across the United States in all of our state offices across the country. So, Billy, I will now be turning it over to you. So thank you very much.
Thank you, Jessica. Welcome from Texas, and I want to go over a program with you today that can be beneficial to you. It's a program in the business programs. We try to bring programs that will help the economy and job creations in the rural, smaller towns throughout the nation. And so the program I'm going to bring to you today can help you in benefiting you, though, through your infrastructure of of your hospitals. The one I'm bringing to you today is a commercial loan. It's for the benefit of the private hospitals and clinics only, and it's to help you in the process of trying to give yourself financing for all needs of the hospital. We focus on the fact that we're looking at helping in locations where the town is 50,000 in population or less. And what we're trying to do is bring you a program that the local lenders, whether it's your state or your federal banks, are financing your needs, but then looking to the government under USDA for a guarantee. Under this program, it can go up to $25 million, and it has many purposes that it can be used for. It can go more than just the IT needs. If you're looking for trying to refinance the debts of the hospital or the clinics, you're trying to do expansions, you're trying to build new clinics or hospitals, or you're just needing to buy equipment, whether it's the IT equipment or any other equipment, or you just need working capital. You can use this program by financing it through the bank with a guarantee. If it's a real estate type of loan, it can be structured all the way to 30 years. If it's a machinery and equipment loan, you're looking at a 15-year note. You do have some fees that get tied to this. At the day of closing of the loan, USDA receives a 3% fee, and then from that point on, there's an annual fee of 0.25%. When we start looking at availability of money, we'll look at what's been spent in this project from 2009 to 2012, and we see that we've had almost $9 billion available for this program. So it is a program that is well-funded, has multiple uses, and we see that we've been able to provide over 14,000 direct guaranteed in grants through our total programs that we have available. As you see, we've helped over 62,000 businesses, and we've created or saved over 321,000 jobs through the United States. With our program, we have a wide structure of offices, and by going to our website and clicking on the state of your location, you can find the local office that can assist you in trying to provide you with the type of financing and assistance you need through our programs. So I'm now going to turn it back to training.
Thank you so much. So many experienced economic development leaders with us today, and I wanted to reiterate for all of our participants in today's webinar just the enormous expansiveness that we have here at USDA Rural Development in financing all aspects of telehealth, health IT, infrastructure, hardware, software, to ensure that advanced, high-quality, affordable medical care is available all across the United States, again, regardless of the remote nature of an area, of the extraordinarily high cost involved in bringing that level of very unique, specialized care to rural communities and to veterans. Now, my colleague Billy mentioned the Business and Industry Loan Guarantee Program. There are numerous loan programs that we have available at USDA Rural Development. One is an intermediary relending program that is also available to finance the construction and the costs associated with building and financing health facilities in rural America. The map that you see here today on this slide number 41 shows the snapshot of the website of USDA Rural Development. I would like for all of our participants on today's webinar to go to this website and bookmark the link, which is listed below, www.rurdev.usda.gov. This will bring you to the map that gives you a snapshot on the left-hand side of the page of all the specific areas that USDA Rural Development provides loan and grant financing for. The programs that we discussed today on the webinar, with the exception of the Distance Learning Telemedicine Grant Program, is administered by USDA Rural Development State Directors. We are extremely honored and pleased to have two of them on our webinar today from Iowa and Kansas, but their colleagues across the United States manage loan and grant budgets that fund specific critical infrastructure needs, training, and technical assistance and capacity for hospitals, clinics, and patients throughout the United States. As my colleague Billy from Texas said, if you click on any state where you're located, you can pull up the USDA Rural Development website for that state, and you will be able to obtain all the information on the programs that we discussed today, how to apply, application deadlines, and all the relevant pieces of information that you need to know exactly how to take advantage of the financing that we discussed today on our webinar. So specifically, I want to reiterate the critical importance for the health community in reaching out to USDA Rural Development State Directors and staff. Billy Kerb works for a state director in Texas who administers a variety of programs covering and ranging from renewable energy projects, broadband projects, telehealth projects, as well as housing, water and sewer projects, and of course, health IT and telehealth projects. The application deadlines, the guidelines for permitting, environmental requirements, as well as the rules, scoring, and application templates can all be provided to you by reaching out to your USDA Rural Development State Director and staff. They provide the technical assistance and the resources for you to take advantage of the programs and how to leverage, and they'll tell you how you leverage these programs, how you leverage the funding that we have to offer with state funding, with other types of resources that are at your disposal. So I know that many of the critical access hospital administrators across the United States in rural areas are familiar with USDA in a number of capacities, but rural development is truly a very unique place and a unique mission area within the federal government that really focuses on how to meet the infrastructure and financing needs of rural citizens, businesses, and anchor institutions. Our state directors and their staff are across the United States in your states and in your communities. It is vitally important for all of you to get to know them and tell them what type of cost challenges that you're facing in providing affordable, high-quality medical care to your communities. They want to know about it. They want to understand what it takes. And these are the people that can help you come up with creative solutions to overcome those cost barriers. So we work very, very closely with our rural broadband providers in providing telehealth opportunities, as well as infrastructure and equipment used by hospitals, clinics, schools, libraries, and all the critical community anchor institutions in a rural area in meeting their needs, in basically staying in their area and basically generating economic value, growth, jobs, and sustainability, ensuring that our farming and ranching communities remain thriving and viable. We also work very, very closely with federal agencies as well as state and local and tribal governments to, again, come up with the creative solutions needed to finance very important projects that you're all trying to grapple with. And finally, economic development leaders. We partner with them in your states everywhere. And so it's vitally important for you to get to know them, but also our state directors and their staffs like those who are on today's webinar, are uniquely qualified to help you connect with these people to devise solutions and opportunities to overcome your extraordinarily high cost of bringing affordable quality care to your patients and to your residents. So we have 47 state offices and field staff across the United States that stand ready and able to assist all of you in overcoming these issues, discussing with you options, and helping you partner and piece together projects that will really help you meet your meaningful use requirements and standards, allowing you to come up with opportunities to invest in electronic medical record database functionality, to purchase video teleconferencing equipment to be able to receive telepharmacy, telepsychiatry, teleradiology, and other healthcare needs that are so readily available in urbanized areas. In addition to our state offices and field staff, we have field representatives across the United States that work directly with the Rural Utility Service. These are experts in telecommunications and in energy. And these are federal employees located in your states to work directly with rural electric cooperatives, rural telecommunication systems, in devising network solutions to ensure that hospitals and clinics get broadband. So get to know these folks. And finally, getting to know our borrowers and grantees. USDA Rural Development, when you go to our website, has a compilation of some of the success stories. We're just a snippet of what we had in our slide deck today, but there are so many terrific examples of just remarkable projects that are really terrific models that you can look at and think about and see how possibly they can be emulated in your community. And so as you go to our website, I urge you to take a look at the list of entities that received awards and speak to them, reach out to them, talk to them, and ask them how they did it. And these are just terrific models for how to duplicate the success of the continuous cycle of investment that we continue to make, that we've been doing for years. Other stakeholders that are so important for the rural health community to partner with is, again, the people that work so closely and the institutions that work so closely in providing affordable, high-quality, basic utility service to your patients and to your customers. So electric cooperatives are people who understand the needs of rural communities, understand what it takes and the cost challenges of hospitals and clinics. We urge you to get to know these folks. We're happy to connect you to them. Rural water organizations in your states are also very focused on public health and safety. They're also infrastructure leaders, and they want to make sure that you get affordable health care. Farm Bureau leadership in every state in the United States is so committed to making sure that health care is a reality for all rural Americans. And then finally, the rural health organizations and education organizations in every state. These are our partners. We work so closely with them at USDA Rural Development, and we really strongly urge you to get to know our stakeholders. These are the people that make it happen in rural America, and these are the people that will help continue to make sure that our patients in rural communities get the service and the care that they need. So as we conclude our discussion, we wanted just to leave you with kind of a pithy thought, as Winston Churchill, a strong leader in making sure that that the people that he governed and led throughout a very turbulent time in Europe, was very focused on continuing to make sure that that the end goal is still within sight and that we remain focused. So by no means is this the end of the work that we're going to be doing as a partnership. USDA Rural Development is committed to making sure that the partnership that we have in rural communities is meaningful and extends to hospitals and clinics. This is really the beginning of the work we're doing in implementing the Affordable Care Act. So we're very committed to that success of that statute here at USDA, and we want to make sure that we do our part in making it a reality and delivering the level of affordable care to all of your patients in your communities. Contacts, if you would like to discuss any aspect of the items that were raised in today's slide deck, please reach out to me. My name is Jessica Zufolo. My email address is listed on the slide. You may also reach out to Leila Sami, who is the Rural Health IT Coordinator for the Office of National Coordinator at HHS. And we strongly encourage you to also reach out to the state directors and all the USDA Rural Development finance experts that we're participating on today's call. These are the folks across the United States that are the eyes and the ears of rural America and will help you meet your goals for affordable care in implementing this very, very important statute. The website listed again on this slide is www.rurdev.usda.gov/state office addresses. At that website, you can get the name, address, and phone numbers of the state directors on today's webinar, Bill Menner and Patty Clark, as well as Billy Kerb, and all of their counterparts in all 47 states. So with that, I want to thank all of you for your participation, your interest, and your commitment to working with us at USDA, and we very much look forward to meeting your healthcare needs moving forward.